Good evening, everyone. Care Nova Scotia acknowledges that we're located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people, and we acknowledge them as the past, present, and future caretakers of this land. This territory is covered by the treaties of peace and friendship, which Mi'kmaq, Maliseet, and Passamaquoddy peoples first signed with the British Crown in 1725. The treaties did not deal with surrender of land and resources, but in fact recognized Mi'kmaq and Maliseet titles and established the rules for what was to be an ongoing relationship between the nations. We are all treaty people. We understand that many of you may be joining from areas outside of Nova Scotia, so we encourage you to share in the chat where you're joining from tonight, and to learn more about the land in which you inhabit by visiting nativeland.ca. So Erica is going to put the link in the chat now. I'm going to turn things over now to Nikki. Nikki's going to be giving us a little bit of introduction and background. Nikki Jameson.
Awesome, thank you, Jody. Welcome everyone, and thank you for joining us for Childcare Now Nova Scotia's webinar, Childcare in Rural Nova Scotia Communities. Before we begin, I do want to note that this webinar is being recorded and will be made available on Childcare Now National's YouTube page. And I'd also like to acknowledge that this webinar was made possible through funding by the Canadian Women's Foundation and through our partnership with Childcare Now National. So I'll begin by introducing myself quickly. For those of you who don't know me, I'm currently the coordinator of Childcare Now Nova Scotia, your host for this event, and the provincial chapter of Childcare Now National. I began my journey into childcare advocacy when I enrolled in the NSCC MSCU Joint Child and Youth Program in 2015. And as a single mother and university student, I relied heavily on the early learning and childcare system to help me navigate through my degree. To this day, I have so many ECEs to thank for getting both me and my son to the place we are today. And it was in this space that I quickly found my passion for policy, and I switched my degree to political science in 2017 in advance of the pre-primary rollout here in Nova Scotia. While completing my degree, I coordinated various advocacy initiatives that related to childcare and education in the province, and I had the privilege of contributing to the CCPA&S Underpaid and Underappreciated report, a report that remains a critical snapshot of the sector in Nova Scotia today. I've since completed my degree, and alongside being your coordinator for Childcare Now Nova Scotia, I'm also a master's candidate in the same field at Acadia University. Since time immemorial, but especially over the last few years, the lack of a dedicated childcare advocacy coalition in Nova Scotia has been evident. And I'm personally so thrilled to see Childcare Now Nova Scotia begin to take shape at such a critical and important time. So as many of you know, on July 13th, 2021, the governments of Canada and Nova Scotia signed a bilateral early learning and childcare agreement worth over $600 million. This agreement provided clear language that aspired to the following objectives: to provide a 50% reduction in average parent fees for provincially funded, regulated early learning and childcare programs by the end of 2022, and for these programs to reach an average of $10 a day by fiscal year 2025. To create more high quality, affordable, regulated childcare spaces, primarily through non-for-profit and public childcare providers, to address barriers to providing inclusive and flexible childcare, and to value the early childhood workforce and provide them with training and development opportunities. Since then, more details on the province's plan to implement this agreement came on January 13th, 2022, when we saw strong commitments to the objectives mentioned in the agreement, and the government revealed they're actually ahead of target with respect to parent fees. This plan is grounded in decades of research, and it's on its way to improving the early learning and childcare system for the benefit of children, families, educators, and all Nova Scotians. All commercial and not-for-profit operators that choose to be a part of the province's system will receive sufficient public funding to allow for lower fees, higher staff compensation, and other quality improvements. With this, we must remember the status quo was not working well for anyone. Commercial and not-for-profit providers were having to operate with insufficient funding and other supports from government that led to a patchwork system that's been largely subsidized on the backs of early childhood educators. As we know, this has led to childcare that has been costly, inaccessible, and did not compensate staff well, resulting in high turnover and the critical workforce shortage that we're seeing today. So today, our goal is to consider next steps for Nova Scotia. We have the bilateral agreement. Our provincial government's taken steps to begin constructing a universal system. But how do we ensure that that system is high quality, accessible, culturally appropriate, and inclusive to all? And more specifically, our focus for this evening will be on rural areas in Nova Scotia. So with that, I will now invite tonight's moderator back, Dr. Jody McDavid, if you'd like to begin. Thank you.
Thanks, Nikki. So we have a limited time this evening for this panel. We have about an hour. So what I'm going to encourage people to do is if you have any questions or anything, you are free to drop them in the chat, but we're also going to be sharing contact info at the end of the session so that you can follow up with any of the presenters and have your questions answered in more detail then. We have constructed quite a few questions. I think will address most of the issues, but we just won't have time to get through everything. So rather than be disappointed, you can contact people afterwards. So firstly, I'll introduce myself and the panel, and then what I'll be doing is working with them to answer some of the questions that we have here. So my name is Dr. Jody McDavid. I'm an instructor in Gender and Women's Studies at Cape Breton University, and I'm also the Executive Director of Cape Breton Transition House, which provides shelter and programs and second stage housing for vulnerable women and children. And I'm located in Sydney, Cape Breton. So I came from a rural environment, so I'm very interested in this panel too. Then we have with us Joanna Latoulet-Rochon, who's the Executive Director for Cape Breton Family Resource Center. And we have Dr. Christine McLean, who's an assistant professor with the Department of Child and Youth Study at Mount St. Vincent University since 2016. Prior to that, she worked in the childcare sector in St. John's, Newfoundland for 28 years. And then we will also be hearing from Nikki Jameson, who you've met, as well as Morna Ballantyne, who's the Executive Director for Care Now National. So now I'll go to some of our questions. So firstly, I'll ask Joanna, where does family home childcare fit into the province's plan, specifically for rural communities?
Thank you, Jody. And that question's not going to take a whole lot of time to answer because we don't know yet. So certainly in terms of the detail, the rollout so far in recognizing government had to start somewhere, really has shared with the broader community where we're headed as far as center-based childcare, but has sort of put a little bit of a flag up and said for family home childcare, which is our other form of regulated care in the province, that the information is coming soon, but soon hasn't arrived just yet. I can tell you that we did have an opportunity. We have just over 15 programs here in the province of Nova Scotia as far as regulated family home childcare. We did have an opportunity to express interest in expanding those programs and sharing with the province, if we wanted to expand, how many homes we felt we could expand to by December 31st of 2022. And so we've sort of had that opportunity. But as far as the details where family home childcare will head, we do know that 70% of the province of Nova Scotia is rural in nature, and family home childcare provides opportunities for regulated childcare to be in very small communities, but we don't have the details yet of where the province is headed.
Thanks, Joanna. Dr. Christine McLean, sorry, I just stuttered over that. Christine, can you tell me why a publicly funded system is necessary?
Okay, thank you, Jody. And also I'd like to thank the organizers. I'm really pleased to be involved on this panel. And I did also want to mention that I grew up in rural Nova Scotia, first in Upper Sackville, went to a 2-room schoolhouse, and then moved to a small community in Richmond County in Cape Breton, and went to another 2-room schoolhouse for a while. So I can certainly understand the particular conditions that people that live in rural Nova Scotia are dealing with when it comes to accessing childcare. But in terms of a publicly funded system, I think it's a matter of, it's quite simple. What we have is not working, and we don't have a publicly funded system. We have a privately delivered system. So whether it's commercial operators or not-for-profit organizations, currently it is, for the most part, privately delivered. The pre-primary programs in Nova Scotia are the beginning of a publicly funded system, but we, if our current system was working, then we would have well-paid early childhood educators who are well respected and have appropriate salaries and benefits, and we would have affordable childcare available to all those who need it. And we know that we don't have that. We've been fighting for it for decades, asking for it, looking for it, needing it. and it has not happened. So we need to switch to a different way of doing things. That's not going to be easy. It's a different way of thinking about children and about childcare and about women. We're looking, instead of looking at children as a private responsibility, we're looking at the value of children as part of a societal responsibility and as citizens in their own right. So that's a big switch for thinking for a lot of people. And that's what comes with looking at a publicly funded system. We're also looking, I think, at the value of women's work differently. The women predominantly women who provide early childhood education, but also women in general who require childcare to work. So when we look at these things differently, we see that really the only answer is to have a publicly funded system that is well funded, that is well managed, and will make a big difference, a huge difference. In all my years of being involved in childcare, I can honestly say this is the most exciting time that I've experienced.
Thanks, Christine. So that's actually a good lead into the question I have for Morna, which is, what has to happen next in Nova Scotia to ensure that the publicly funded, publicly managed universal early learning and childcare center is built in the province and made accessible to the rural communities too?
Well, actually, I think that the government of Nova Scotia is on the right track, and they have signaled that they're going to be taking the steps that are necessary to bring licensed high quality early learning and childcare to every community, but in particularly rural communities. Because in Nova Scotia and across Canada, as has already been said, rural communities are for the most part what we call childcare deserts, where there just isn't enough licensed childcare to be able to meet the needs. And it's, as Christine was saying, childcare has really been left to individuals to figure out. That's true for individual mothers and fathers or guardians, but it's also true for those who provide childcare services. So where we have childcare in Nova Scotia, for the most part, is because individuals have stepped up to provide it. And this is particularly true of home childcare, but it's also true of center-based childcare as well. And so if we're going to get childcare into rural communities, high quality licensed childcare that's affordable, that's inclusive, that's culturally responsive, that meets the needs of children, also meets the needs of parents, and meets the need of community, then, as Christine was saying, governments are going to have to make it happen. So what's critical is for governments to assume responsibility and put in place the necessary infrastructure to make it happen. And by that, I mean that government is going to have to build some capacity to plan the expansion of childcare services. So until now, as I say, we have childcare because people in communities have stepped up. Government is actually going to not only have to go out and solicit some opportunities, but find ways to make it happen, put in place incentives. That is absolute. So we need a central planning authority and capacity, but it can't all be done centralized. There's going to have to be all kinds of mechanisms, links to communities, so communities can have a say about what childcare they need in their communities. And there are going to be some differences. So some might need more home childcare, some might need licensed childcare. There might be need for childcare with flexible hours, longer hours. They're going to be, employers are going to have different needs in different communities. Some communities, for example, in rural Nova Scotia, are desperate for more healthcare workers to be able to provide healthcare services. Well, they work shift work. So there's going to have to be childcare that's available for shift workers. But the most important thing is to rely on government. So I say Nova Scotia is on the right track because they've said that they're going to put in place a not-for-profit agency. My hope is that it's going to have a central role in the planning of the expansion of childcare. Also, to make sure that there's a trained, qualified workforce to be able to meet the expansion. You can't have more childcare if we don't have more early childhood educators in rural communities and everywhere. So those are just some of the pieces that have to move forward.
Yeah, that's a great point. That's a great point, that there needs to be more people in the sector for sure, and supported properly. Talking about that consultation, really going back to you, Joanna. So how do you think policy makers should start speaking to people in rural communities about their unique needs? And then what do you see as the role of the ECEs and the center directors in these conversations?
Certainly, I see it as being really important that we look at who is it currently that is working with, connected with our families that have our youngest children, because I think from that government perspective, or from a central perspective, we really need to find oftentimes our informal community leaders in the area to help get the word out and to help gather people together. So certainly, you know, some combination of in-person sessions, virtual sessions, those sorts of things. But I think we jumpstart the process if we go to places like our family resource programs that are across the province. It could be recreational programs that are across the province that are already working with families with young children. It can be getting the word out through the school system, recognizing that oftentimes our children that are in school have younger children at home, and really working community by community to sort of find out who are the leaders in those communities, who can gather the people together. You know, whether that's another place to go is to look to our elected officials and letting their offices know that we really want to hear from people, because oftentimes our elected officials hear from those that are struggling with certain issues, and certainly in rural Nova Scotia, childcare is one of those issues. So I think we have to use every avenue that we can to get the word out. Social media plays a role. Even this evening's session certainly plays a role in getting the word out and looking at that. So those are sort of some of the avenues. In terms of the role of directors, the role of our centers in terms of participating in those conversations, well, I think we've just named the first role. It's encouraging people to come out to the sessions and participate. If we do want to hear from people that are struggling with childcare issues, we're going to have to recognize that if we're having face-to-face meetings, we might need some childcare there so that folks can actually bring their children along with them and provide that as a normal, usual expectation of gathering families with young children. I also think we can be looking at where are we having those meetings, if they're, you know, and ideally face-to-face meetings work well. And are the spaces set up well so that we have high quality experiences for children that are coming along with their parents and caregivers to participate in those kinds of sessions. I think our directors are very well skilled at facilitating those kinds of meetings and sort of moving through. They know their communities very well, so they would know, you know, they should be involved on every end of it, from sort of looking at what kinds of questions do we need to know, what are those answers, where is the best space to have these meetings, all of those things. So I think right from the beginning to end, and I think that involvement needs to be very genuine, and the best way to involve people is always, you know, as early in the process as possible.
So Joanna, I think too, one of the big questions that has come up has been around the issue of a lot of CECs having left or considering leaving the sector. And I guess that would be one of the things people would need to consult about. But can you give us a sense of why that is, and what might need to change, especially in rural areas, to address that?
Sure, I can. You know, I think in our province, as we've opened up a wider range of opportunities for early childhood educators, which has been, I think, a very positive thing, we've perhaps inadvertently sent a message that early childhood educators in the pre-primary programs or early childhood educators working in developmental intervention programs are perhaps more highly valued. And though those words were never said, I think when you look at the pay structure, when you look at the benefit structure, when you look at the hours that people get to work and those sorts of things, the provision of benefits, unfortunately, that sort of same level of care and acknowledgement and valuing didn't seem to fall into our childcare sector. And I would really hope that this is the time and these are the hours where we're going to extend that acknowledgement of the value and the need for childcare in regulated childcare sectors. Hopefully we're going to see that come through. And I think through the pandemic, in some ways, it shone a real light on the fact that we are not going to have a stable workforce. We are not going to be able to maintain essential services if we don't figure out that childcare, high quality, so that our parents can go off to work knowing that the children are well looked after, well cared for. It really is the very basic essential service. And that's why our business community, our government departments, our educational institutions, it's why we all need to care about childcare, whether we ourselves have young children or not.
Thanks, Joanna. Christine, I think this question has come up from time to time, and it is, why not provide individual grants to childcare providers?
Okay, thanks, Jody. Good question. And I'm really enjoying listening to the other panel participants too. And I want to jump in and, talk about things that they're talking about as well. But in terms of individual grants do not create a system. And we know that it's funny, a day that will live in infamy. In January 2006, when Stephen Harper was first elected, and the first thing that he did was get rid of the multilateral agreements that had been signed and instituted a universal child care benefit that was individual payments to parents. We know that was not, did not create a system, did not build any spaces. And the analogy can be, imagine if we had a universal pavement benefit where we would say, okay, community, you get together, we're all going to give you money, and maybe some of you can get together and hire the bulldozer, and some of you can get the asphalt, and some of you can, decide who's going to do shifts. Like, that's not how we build any kind of system, by giving individual payments or individual grants to either parents or providers. Now, there will be, of course, individual, there will be direct funding to providers and to centers, but it'll be within a system that has requirements that need to be met in order for the payments to happen. So, so it's not that there won't be payments and that there won't be remuneration and money that is going to allow for a new fee structure and a new compensation framework. But if we just said, okay, we're going to just give people money and let them figure it out, then we're not any further ahead. Right? We're just having more of the same. And we don't have, we know that that's not going to work. I did want to mention, if I could, just building on what Joanna was talking about, I got up early this morning and I listened to the news conference from Newfoundland. I think it happened yesterday, but I listened to it this morning. And there's some really cool things that they're doing with family childcare as part of their agreement, the Newfoundland and Labrador Canada-wide Early Learning and Childcare Agreement, where they have family and childcare connections, which I'm sure some of you are aware of. That is a family childcare agency that started in St. John's and was a project done in cooperation with the CUPW. And that agency model has really grown. There's also individually licensed family childcare in Newfoundland, but they announced in their latest announcement that they are going to also add, branches of the Family and Child Care Connections Agency to Central Newfoundland and to Labrador, and they already have expanded into Western Newfoundland. And so I thought that was quite interesting to hear about how family child care is being supported in their early learning and child care agreement. So I think one of the things that we need to really be looking at is what are the different initiatives that are happening across the country, because those are the things like Joanna that you were saying, when people come out and the policymakers start talking to rural communities, that if we know about these different initiatives that are happening, then we can point the policymakers to that. Not that they don't already know, but it would be good to start a conversation about that. So I'm sorry, I went off track there a little bit,
okay.
but in terms of the individual grants, doesn't work. That's not how we have any other kind of system in our program, if it's an individual grant, without having any kind of structure involved in, how and why that is paid to providers.
Yes, thank you. And I know one of the biggest challenges for people, because I have my children in that era, was that you were provided with a benefit, but then there was no place for childcare. Like there was no place that could provide childcare. So you got the money, but then there was no childcare slot.
Right.
And I also know when you go back, I spend a lot of my life in the grant writing world. And the thing about grants is that they're not for sustainability. Like it's not, the idea is always that you will get off that grant. And so, it's a patchwork process. It's not a whole system. And what we're looking at now is, from the way I understand, is developing a system rather than a series of things that don't really work together.
There was a famous political cartoon back in the day in 2006 where people were using their universal child care benefit to pay for the gas that it took them to drive, from center to center trying to find a space. So, and also just interestingly that the language of the child care advocates in terms of universal child care was co-opted by the conservative government at that time to call it a universal child care benefit, so they could say, yeah, tick, we've done that. But anyway, there you go.
Thanks, Christine. Morna, rural communities face some challenges when trying to access licensed childcare. How can this be addressed as we move forward with this agreement, the NSELCC agreement?
Well, I think that the two major barriers with respect to access for rural communities, or I guess maybe I should put it in terms of rural families and their access, is it's not available for the most part. There's just not enough of it available. And of course, if it is available, it's still expensive. So one of the key features of the Canada-wide system of early learning and childcare will be lower fees. It's said that they will be affordable fees. It's going to be really important to make sure that affordable really does mean affordable. That if fees are being lowered, they're going to be lowered to a level that truly is affordable. And so what we support is a low fee provincially set, but we also would like to see programs and assistance. It can be done through, for example, a sliding scale fee to make sure that every family can afford to have access regardless of circumstance. I think it's also really important to say is that if we're really talking about a universally accessible, available, inclusive system of early learning and childcare, we have to think of it as not just being a system that supports working people or people who are attached to the workforce, that we have to think about it as a system that is really good for children, and that all children should have access regardless of their parents' circumstances, whether they are in the paid labor force or whether they're not in the paid labor force. And it's really interesting that where there is free preschool programs or free kindergarten programs, and by free, I mean fully paid for by the government, the take-up is universal. Almost everybody, if they have access and they can afford it, early childhood education, they use it. And that's true for people who are in the paid labor force, trying to get in the paid labor force, or for whatever variety of reasons will never be in the paid labor force. So I think that's one of the things we want to do, is make sure it's truly affordable. The other thing, as I've said, it has to be there. It actually has to be available. And for rural communities to have it available in their communities, they're going to need support. They're going to need, the system is going to have to be fully funded, not by a local level of government and not by community, but actually at a higher level, provincial and federal, and especially federal, but also provincial, because those are the levels of government who have access to the largest tax base. You can't put the responsibility on community government. However, it's really important to engage, I think, community and local government, and also the education system. I mean, you know, rural communities, it's not like kids in rural communities do not have access to public education. It's not as if kids in rural communities don't have access to the public health care system. The main reason they do is because those are fully publicly funded systems. So that I keep going back to that, it has to be a publicly managed, publicly funded system. And by publicly managed, again, the onus has to be on the government to make sure it is there in rural communities, and done in a collaborative way. Like I was sort of intrigued by, not intrigued because I knew this happened, but you know, the Nova Scotia government, soon after the agreement was signed, put out requests for proposals. That was mentioned, you know, to the sector is, you know, here's some money, create childcare. That is really hard to do. You're once again putting the onus on individuals and individual programs to make sure the childcare puts in place. This has to stop. You know, yes, of course, individual programs have to be involved, but they have to be fully supported. You can't just throw out requests for proposals and hope that the childcare ends up, the licensed childcare ends up in rural communities and in other communities where they are needed. And they also have to be designed to serve the full populations of the community. So those are just a few thoughts on that.
Thank you, Morna. That's great. I've been thinking a lot about that, because a lot of you are probably aware we have a big challenge with child poverty in Cape Breton. It's a huge issue. And I mean, there have been a lot of studies in other countries and things about early childhood education having an intervention sort of role in that, or at least providing a space where children are getting a mental health break from whatever is going on at home, or children are getting a healthy snack, all those sorts of things. And that there really is that other role too in society to make this accessible to everyone. So it's great to hear you talk about that. I have a question I'll open to everybody, and in a way, it's the question that we can all use to argue with our colleagues at the water cooler later on, because I think in a way it's preaching to the converted. But the question is, why is an accessible, affordable, and high quality system of early learning and childcare important to families, children, and educators? Like, why do we need this, really? You know, in case people haven't quite gotten their heads there yet, or if they're trying to argue this point or have further discussions. I know a lot of us are all very political and involved in lots of levels.
I'd like to jump in there and just sort of start that conversation with this sort of concept I've been playing with over these last couple of days around, I was in a session where they were talking about sort of giving people undivided attention, or giving a piece of work undivided attention. And I realized that in some ways, with all of the responsibilities to multitask, I've become a bit of an expert at divided attention. So when I think about all of the aspects of providing that high quality childcare that we absolutely need, there's, you know, there's recruitment and retention and orientation and training, and there's paperwork, and there's advertising for new childcare providers, and there's providing, you know, regular supports, there's waiting lists and managing waiting lists, there's advertising, promotion, there's all kinds of things. And I think when I think about the value of that systematic approach, it's to take some of those tasks away and to address some of those tasks from a systemic point of view, so that our services that are on the ground and community can really focus on the actual provision of the service and the provision of childcare. Really appreciating comments made a little bit earlier about, when you give individuals money to buy a service, if the service isn't there, it doesn't matter how much money you give them, it can't be bought. And so I think in the same way, a centralized system is really important, because our undivided attention is really what our children and our families need. And I think the taking away of some of the multitasking will help us focus in the areas where perhaps we're skimming the surface these days.
That's a great point. I hadn't considered that, but I can totally understand where everybody's turned into an administrator and things, as well as a caregiver and all those other roles. Must be very challenging. Morna, did you want to add to this? Or, sorry, I just saw somebody pop up.
I'd like to add to it if I could.
Oh, sure.
Because I think you were right, Jody, when you said that we're preaching to the converted here, but there are all kinds of people who, believe it or not, are not going to think this is a good idea. People outside of the early childhood field who are thinking, no way should my tax dollars go to paying for other people's children, right? I raised my own kids without any support from the government, and why should my money be going to pay for that? So I think that's a question that we need to be prepared to talk about. One thing about the pandemic is that it really made the need for a childcare bubble to the surface, right? Where we saw people not being able to get to work. We saw the effect that it had on the healthcare system, on the economy in general. So I think it's convincing those that are who may be reluctant to see this as being a good use of tax dollars, to understand the whole, how childcare fits within the community in terms of not just the economic support and participation in the labor force, but also, as Morna was saying, providing good, healthy, developmental environments for children. And Joanna was saying it as well too, because we want to give children that, they are entitled to that, and that it's going to help. I don't want to see children as being a future agenda item, but it is going to help in the long term if we're providing those high quality services across the board to all children. So I think it's having, you might not have kids of your own, or you might not have young kids, but you are affected when there is no regulated childcare in place, whether it's in rural communities or otherwise. So I think it's just being able to look at that angle as well.
I think one of the things too, eventually, that could come to light with this is that early intervention is such a big deal with children if they have any learning disabilities or anything like that. And for a lot of parents, if you've not been exposed to other children, or you only have one child, you're so unaware of these things. And really, to have a system like this where children are provided with this care, where they've got trained ECEs, it really could, in the long run, be a benefit to the government, because people would get the supports that they need at an earlier time frame. And I say that as a parent of a child with special needs, so I understand how some of those things go. I'm not trying to be critical. I'm just saying that having that more of that early support could definitely make a big difference for people with lots of different home situations. So I'll ask people as well, and again, if other people want to chime in on this is Joanna, you might have more to say about this one, is that right now there's a bit of a lack of qualified staff in the sector, and it's a bit of a concern. So how can this be addressed in a way that will empower the ECEs and aid in retention and recruitment?
I think, again, we've learned, much like today's session, we've learned of the power of technology in terms of education and training. I think as we solidify the sector as a sector that actually can provide a very rewarding, very stable environment for people, and it can be a career. And I go back to thinking that you know, it hasn't been central that our childcare providers and the provision of childcare is an absolute essential career choice, and that its pay is, you know, it's paid well enough that you can reasonably earn a good standard of living, and that you can depend on that line of work, and that there are options available for different ways of living that. So whether it's, you know, regulated center-based care, regulated home-based care, whether it's in pre-primary programs or other such things. I think, you know, first and foremost, in order to attract people to that sector, we need to make sure the sector has the kinds of things that other sectors do. We need to have pension plans, we need to have benefit plans, we need to have you know, ongoing professional development. We need to have choices about where people, how people develop their expertise, those kinds of things. So I think it really is back to that showing action around. I think we're talking about valuing a sector and supporting a sector. I think there's more conversation now about the essential nature of the particular sector, but certainly we have to really fundamentally put the money where our mouth is in terms of being able to build something and attract people. And then I think we have to use those mechanisms. If you want rural childcare provision, you need to be doing a lot of on the ground work. I think about Cape Breton Island, and to think about how many kilometers we drive, and you just, there's no doing it from Halifax. You got to get in your car, you have to drive to Bay St. Lawrence and sort out that Bay St. Lawrence has a highly seasonal workforce. So your childcare might be a seasonal variety, and our fishers go out early in the morning. They're up and out at 4 o'clock in the morning. So what about overnight care? What about, you know, care that starts at, you know, 4 and 5 o'clock in the morning and is finished up by dinner time or 1 o'clock in the afternoon? We need to be thinking about non-traditional hours. We need to be thinking about infant care. You know, our experience of opening family home childcare programs, so approving those homes in Cape Breton, we've never approved a home. By the time the home gets approved, all of the spaces are filled and there's a waiting list. Okay, and that's before we've even got them approved. So people start to hear in community that this home might be approved, and before you know it, by the time it's approved, we have never gone out and really advertised as an organization that we have this license for family home childcare, because basically we would be advertising a service to attract people to come to try to access that service. And we don't have any spaces because all of our providers have waiting lists and a full group of children by the time they're opened. So, you know, I think there's a lot of work to be done that's really on the ground, old fashioned, if we want to call it that, moving from community to community, learning what's the difference in the kind of childcare that Bay St. Lawrence needs versus you know, maybe Manadoo, which is outside Glace Bay. Their communities all have different rhythms. They travel in different kinds of ways to access service. The more we know about that, the better the system will be in terms of being, we have to have the right kind of care, the right kind of hours. So I think the universal principles are great, but how they play out is going to look very different. And I think we have to have a really flexible system.
Thanks, Joanna. Christine, I've got a question for you, but we only have a couple minutes left in this roundtable portion, so I'm really sorry that we've got asked you to be succinct, but I was wanting to know what you thought the biggest challenge is moving forward with the NSELCC agreement.
Yes, and I'll be quick. And basically it is supporting and strengthening the early childhood sector to get more early childhood educators. So, you know, just building on what the other panelists have said, you know, there's a need, of course, for improved salaries and working conditions, but also looking from a pre-service point of view, I'm working with students who are potential early childhood educators, that we need to provide support for those who are working towards their classification, intangible support in terms of bursaries and grants to cover the cost of when somebody is working and going back to school at the same time, and they have to do a practicum placement, for example. Like, it's hard to take 3-4 weeks off work, even if you're doing it in your own workplace, because you still have to be out of the ratio. So just looking at real practical ways of supporting students to make it through their program. And I know there's a lot of bursaries have become available, but we might need to have very specific ideas for how to help people to complete their practicum placements. There's lots of spaces open, or there's lots of programs opening up, in colleges and university. I know that our program at Mount St. Vincent is completely filled up already. So there's certainly a lot of interest in people entering the field, but we need to help them to get through that either 2-year program or 4-year program. So they, and that they're still excited about entering the field at the end of it. So I won't go on about that, but I would just say that no sense in building spaces and having an affordable fees if we don't have anybody working in those spaces.
Great point. Thank you. Morna, yes, I see you've got your hand raised.
Yeah, I did. I just wanted to add just a couple of thoughts on the obstacles to, or, what are some of the barriers in the way. And, Christine covered some of the details, not the details, but some of the big obstacles, like with respect to making sure that there's a sufficient supply of qualified early childhood educators. That I want to go a bit of it and add, I guess, a little bit of a separate thing. Maybe it's related, is that I think we're talking about huge change here. We're talking about moving essentially from a market-based system of the supply of early learning and childcare to a more publicly managed system of supply. And it's going to require people to conceive and think about early learning and childcare very differently. And it's going to mean that everything is affected, from day-to-day operations to very big things like budgets, how much money, and so forth. So I think one of the things that's going to be really important to pay attention to is how that change is managed. And also, I think there has to be a lot of attention by government, by advocates, by everybody who understands that the way things were working did not work. Christine said that they were not working very well. To get others to understand that when things don't work well and you have to change them, it means everybody has to get involved in making sure that the change happens and it is going in the right direction. And government is going to have to be encouraged to persist and to not to get blocked. And that's going to take significant pressure, because we're talking, other countries, Sweden, it took 30 years to build a fully comprehensive system of early learning and childcare that now serves about 93 to 95% of the population. Norway also took many years. This is a long-term project, and it is going to have public support. It's going to have support from those who work in childcare, from parents, but also all the others who benefit from having a proper system in place. So I think that's something we have to pay a lot of attention to, is the various areas of resistance to change, and make sure that those who are resisting change, who want to continue to do things that the way they were happening before, which was not working for the majority of children and the majority of parents, or for the economy, that we have public debate about this.
Mm-hmm. No, that's a great point. There will be some challenging times, even around policy and things like within the individual organizations as they move forward, and all those sorts of things that'll have to be ironed out.
And not everybody's going to be happy. And I think we also need to be comfortable with that as well, too, because I think that's when we see the politicians trying to backtrack or waver, or, try different ways to massage the change. But it's going to be huge a huge difference for everybody, and not everybody's going to be on board with it. So, but those of us who are on board with it need to make sure that the policymakers and the politicians are hearing from us as well.
Mhm. Would this be, I think this might be a good point to, I'm going to come back to you, Morna, in a second, because you're going to give us a national update, but this might be a good point to ask Nikki to talk about participate in Nova Scotia action, perhaps, because we're talking about what might be required in that. So I think that Erica is going to drop the link in the chat. Do you want to just mention what this is, Nikki, for us?
Yeah, totally. And firstly, I just want to thank everybody for taking the time to be here, because just being here shows your commitment to moving towards the system together. Like many of you, we're excited about the announcements and the changes, but I just want to talk about one in particular, and that's the expansion of the 9,500 spaces that's been promised for fall. It's been an exciting talking point that government's been talking about in recent announcements, but I think we really need to remain critical that they've yet to address how these spaces are going to be staffed, and they're yet to acknowledge that the critical state that the sector remains in, that we've heard from so many of you tonight. It's impossible to build this system that I'm hearing folks talk about without acknowledging this. And government's promise to address the compensation framework and the workforce strategy by the end of 2022 risks coming in far too late. So on International Women's Day, we actually launched a campaign to tell government just this. Eric has dropped the link in the chat. So for more information, please, I encourage you to visit this link, send a letter to your MLA, letting them know, and then also encourage your friends to do the same. We know that ECEs have waited too long. We've been hearing this consistently from folks tonight and for the last couple decades. And I think we really need to come together to demand access to decent wages, benefits, pensions, and sick leave together right now so that they can help us build this system. They've been taking care of our families for decades in a system that's been subsidized on their back. So I think it's time that we take care of them. We know that they're the core of our early learning system, and we really need to drive this home, that there is going to be no successful expansion without ECEs. So again, if folks want to visit the link in the chat, send a letter to your MLA, tell your friends to do the same. I think it's time that we make sure that they hear us loud and clear, and we can only do that together. So thank you. That was perfect timing, Jody.
No problem. Thanks. Just saw the opening. Morna, I'd like to go back to you for a little bit of a national update as well.
Well, we're actually, Childcare Now is going to be hosting another webinar within a few weeks, so keep tuned for that. We'll make sure word gets out where we will be providing a national update. So March 31st, 2022 marks the first year of the 5-year program. So it seemed appropriate to just sort of check in and see who's advancing, how they're advancing, and all the work left to be done. I would just say generally that there's two big areas of concern right now that are impeding progress. The fee reductions are extremely important, the parent fee reductions, but in many respects, it's fairly easy to reduce fees as long as the revenue is replaced with public funds. But what it doesn't, dropping the fees and just replacing the revenue does not bring about transformative system change. So what we really need to continue to push for is that the system be fully publicly funded sufficiently to be able to raise the quality of programs. This is true for center-based childcare, and it's true for home-based as well. And of course, sufficient funding, which is going to be required to pay proper compensation. Just picking up on Nikki's point. I mean, who is working in childcare, and the qualifications of those who are working, the retention of those who are working in childcare, all those determine whether or not the programs are going to be high quality. Another really important aspect is to make sure that the programs are truly inclusive of all cultures, of all populations. And there's a lot of work to be done. And of course, a big area of concern is expansion. Yes, there's been a commitment to expanding primarily in the not-for-profit and public sectors, but no government yet has put in place a plan about how it's going to develop the not-for-profit and public sectors to be able to provide the childcare that is so desperately needed. So just across the country, this is true for Nova Scotia, it's true for every province and every territory. Those are going to be the things we're going to be spending a lot of time talking about and advocating for, is planned, fully funded expansion of programs, which includes more capital funding. We have put in a request to the federal government that they actually budget more money earmarked for supporting capital expansion, capital like the building costs, and the land acquisition costs, so that there can actually be more facilities. But very importantly, the question of workforce. A lot of attention has to, as has been said so many times this evening, there can be no more childcare without more qualified early childhood educators, and to have more early childhood educators, to bring them in and keep them in the system, they have to be paid adequate, not just adequate, they have to be paid their true value. And we are a long way from that across the country.
Thanks, Morna. Yeah, I think that's really the message that I've taken away from this definitely is one to do with the workforce for sure. There are several messages, but that's one thing that is definitely coming to light as a common theme here within it. I just want to thank our panelists for taking part in this tonight, bringing their expertise and time and knowledge, and getting back online after a long day. So I appreciate that. And to all of you that joined us here this evening, thank you so much. We're going to send a recording to all of you and some relevant emails. And we hope this was informative for you, and just want to acknowledge the collective work that all of us in childcare have done to result in Nova Scotia's system building and expansion. I know a lot of people have been working very diligently for that. So please feel free to connect with us over email, Twitter, Facebook, and Instagram. Erica's just dropping those links into the chat right now. And I really, again, just want to thank everyone for attending. And I hope you've all gotten some great things to some food for thought tonight. I know I certainly have. So thank you again.